I'm here with Dr. Kristin Motley today, Health Commissioner of Chester, and this interview is going to focus on the current health landscape in Chester with particular attention to the closure of Crozer Health and its impact on the emergency response in Chester and also the role of local leadership and community initiatives that Dr. Motley's involved in. So,
Thanks, Ella.
could you start by introducing yourself and your role as Health Commissioner?
Yep, so I'm Dr. Kristin Motley, born and raised in the great city of Chester, Pennsylvania, and I have the wonderful opportunity to join the city of Chester in the Bureau of Health as Health Commissioner, a role that I was honored to be offered, and a role that I had a good understanding in terms of what I wanted to do when I started this job, but things changed fast when Crozer started to deteriorate, and so it's been interesting. It's a lot of work. It is definitely a lot of work. I'm a Bureau of Health of one, although I have an amazing group of people and organizations around me that have supported me in a number of ways, and so I'm not doing it all alone. But it does feel lonely sometimes when I just it's a lot.
Yeah,
It's a lot.
So
I'm grateful though.
you're born and raised in Chester. How have you seen the city's healthcare system evolve over your lifetime, and how does that compare to the developments in the past year with the closure of Crozer?
Yeah, I mean, so Crozer Health has been a staple in the community for decades. I was born in Chester at a former Crozer building at Sacred Heart is what it was back then in the 80s. And they were the go-to place. So Crozer was the go-to for healthcare. We had all the top specialists. We had the burn center. We had, just a great community of healthcare providers that had been working at Crozer for years, for decades, especially their labor and delivery team. Those nurses had been there for so many years, 30 or 40 years. And so it was just great that we had providers that knew the community, that knew the needs of the community, and was able to meet the needs of the community. And so it's just really heartbreaking to see what has happened and what has been allowed to happen. It really breaks my heart.
Yeah, I believe over 3,000 healthcare workers were displaced after Crozer shut down.
Yeah.
Do you know where any of them went afterwards?
So I know that there were a number of health systems and healthcare institutions that were holding hiring events. There was a big hiring event in Chester. And so some of them may have been able to find employment. I'm not sure what the numbers are, but I do know that a lot of them are still looking for employment. A lot of the former Crozer employees still are unemployed. They don't have insurance because they also lost their insurance. And so their family is uninsured, and it's just been devastating to the employees as well as to the patients.
So you were the founder of two prominent healthcare organizations in Chester, right? Healthcare Solutions and Health Educated.
Yeah.
So how has operating these two foundations been since the closure of the hospital?
So Healthcare Solutions of Delaware Valley is a for-profit. So I started that over 10 years ago, and I started that organization mostly to help people who could not afford to pay for their medications. I would help them get their medications for free. And so that has evolved into a consulting firm. And so now I mostly work with organizations on employee health and wellness, employee engagement strategies, and doing some DEI work in that space for employers. And then Health Educated is a nonprofit that I started through the pandemic. So in 2022, we got started in terms of educating the community about important health topics. So during that time when COVID came on the scene, there was a need to educate the Black Hispanic community about COVID and the vaccines. And I was tapped by a number of organizations to help with those efforts. And so that's how Health Educated was born. And so we have evolved from COVID. We've expanded and offered a number of new services and new programs where and it's just all about educating the community about health topics so they can make informed decisions. Right. We also educate healthcare providers on how to take better care of people from marginalized communities. And we also expose young people to advanced careers in healthcare because we know that you can't be what you can't see. So we want to give young people, especially those from marginalized communities, an opportunity to see themselves through healthcare providers.
Yeah. With the absence of this major healthcare provider for the community, what resources have you been directing people to when they come to you at Health Educated?
So most of the work has been done through my role as health commissioner. Before Crozer started to crumble, Mainline Health had reached out to me when I became health commissioner to ask how can they support Chester. They wanted to know, what can they do to support the Chester community? And Chester has been lacking healthcare providers, just primary care providers, pediatricians, and dentists for so long. And so even when Crozer was here and the hospital was here and thriving, we still didn't have enough primary care healthcare providers to meet the health needs of this community. And so knowing that, my initial plan in this role was I wanted to address the environmental issues that are plaguing this community. Mm-hmm. And I also wanted to bring in more healthcare providers in pediatrics and for adult medicine because it was just lacking. And right. We have a dismal infant mortality rate. And so we were working to even look at a newborn clinic so that when women had babies at Crozer, they had somewhere to take them because Crozer Pediatrics closed a few years ago. So that took away a number of pediatricians who were here to care for children. And so we were looking at working with the Foundation for Delaware County, the Delaware County Health Department, Nemours was at the table, Chest Penn was at the table, and a few others to see how we can start a newborn clinic to help moms with their newborns. And so I was ready to get that geared up.
Yeah.
And then I also wanted to bring in volunteer healthcare providers that could help to serve the needs, the primary care needs of the community. And so I was looking to, start a clinic or like a volunteer-based, community-based services, and moving along that line. And then we got the announcement that Prospect may be filing for bankruptcy, and then it just derailed everything that I thought I was going to do in this role. And so once they filed for bankruptcy, I was already in conversations with Mainline Health, like I mentioned, and they described to me Together for West Philadelphia, which is an initiative to get people from West Philly connected to healthcare providers. So when they described that to me, I said, we can do something like that in Chester. So then we started Together for Chester, and we pulled in a number of organizations to help do that. And so now through Together for Chester, we help people get connected to healthcare providers throughout the region since we historically haven't had any. And so it was going to get done regardless if Crozer closed or not because we just need primary care physicians here. But once Crozer started to crumble, we expedited the process and really got things off the ground really quickly. So that's the main thing we're doing is getting people connected to new providers through Together for Chester. And we have a number of partners at the table. So I'm really grateful for Mainline Health for reaching out to me initially to just see what they can do to help Chester, even before Crozer became an issue.
Right. So the biggest issues that you've been tackling, you said, were newborn care, environmental issues. Can you give me an example of some of those that Chester residents are facing?
How much time do you have?
Well,
I really hate that I even have to talk about this, but it's just our reality. So Chester is home to a number of polluting industries. And on top of that, we deal with the pollution from a number of other sources. So we have all the fuel emissions from 95 that runs through Chester. Right. We have an industrial highway with emissions that run through Chester as well. We have an airport that's about 10 minutes away, and then all the emissions from the airplane that spew into the atmosphere We are the home. Oh, and we have passenger trains and freight trains, and we have boats, and so all of these emissions from all of these sources, we breathe that air.
Yeah.
We also are home to a number of chemical manufacturing firms. We have the country's largest trash incinerator. The country's largest trash incinerator is in Chester. Spewing emission as well. We're also the home of the county's solid waste treatment facility, and the emissions that that result from that plant. And we are neighbors to oil refineries. It's just a lot of manufacturing that happens in Chester. Mm-hmm. And so that comes with pollution. It comes with toxic air pollutants. It comes with volatile organic compounds. And so you have to breathe to live, and you can't see these things, but you see the results of them. You see the infant mortality that is 5 times the national average. You see the pediatric asthma, which is 4 times the national average. You see the disproportionate rates of cancer, heart disease, kidney disease. These things you see in disproportionate numbers for Chester residents, because we're in such close proximity to so much pollution. And so and the other thing is lead, which is one that we can control more than the others. Because Chester is the first municipality in the Commonwealth, we are an old municipality. A lot of the homes were built decades ago, long before lead paint was banned, long before lead was banned in water pipes and water fixtures, and so lead is still around. And so
I read your children's book at Chester Education Foundation.
Oh, good.
Yeah.
Good. Oh, I'm glad that you read that book there. So lead is so prevalent in our community, and the impacts of lead are just devastating. And so as long as our children are exposed to lead, I don't see the plight of Chester improving. I really in my mind, it is lead that is driving a lot of the poverty. It's the lead exposure that is driving the performance in school, the lead exposure that's driving autism and the ADHD and the delays in cognition, the speech delays. And then later in life, for young people, lead increases the risk of infant mortality. Mm-hmm. It also drives the kidney disease and the blood pressure, and it just has a lifelong impact that is irreversible, which is why we have to do more to prevent our children from being exposed to lead. And so that was a program or an initiative that I really wanted to hit hard when I started in this role, but I have not made as much progress as I wanted because Crozer closed, and it's just diverting my attention, and it's just always another thing that will just take me from what I really want to do, but I'm just doing the best that I can.
Even before the closure, do you think that the hospital was adequately meeting the needs of the community members affected by?
That's a good question, because the hospital closed about 2 or 3 months ago, but we still led the state in pediatric asthma and infant mortality. And so I think there was still a lot of work that needed to be done.
Yeah.
A lot of holes that were not plugged. People were not getting the care and the education that they needed. And so that drove a lot of the numbers that we saw. But the pollution is causing the problem. So if you are not doing anything about the pollution, then you're not going to do anything about the pediatric asthma and the infant mortality. And so the air pollution is a big part of what is driving the health outcomes in Chester. And so we could have had a state-of-the-art facility with all the top researchers, but if we're not doing something to protect our air, then we are not doing anything to protect our people. And so we have to look at ways that we can better improve the air quality. That's just what it comes down to.
And that definitely goes beyond healthcare.
Yeah.
I mean,
it could be 10 hospitals here.
Yeah.
But we still want to have to breathe the same air. And so if we're not preventing it, then we're treating it. And I like to be on the prevention side as much as possible.
This is kind of a question off track from this, but how are you helping residents who don't have transportation to a hospital farther away? I know Crozer was in walking distance for a lot of residents. What do they do now for primary care?
That concerns me. It concerns me a lot because we did not have enough primary care providers. Thank God we have Chest Penn here, but Chest Penn can't meet the healthcare needs of 34,000 people. And so we know that a lot of people would go to the ER for primary care. They have a stomachache. I was in the barbershop just checking on the guys one day, and one of the barbers said, yeah, my leg hurts. And I'm concerned that Crozer going to close because where I'm going to go. I'm like, I know, but you said that your leg hurt. Like, why would you go to the ER if your leg is hurting? It's like, I don't have a doctor, and I don't have insurance. You know, like, I'm a barber. Like, I have to go to Crozer. And so we know that because people don't have health insurance, which is embarrassing in a country that's supposedly a great place to live and to thrive, we don't have health insurance. So many people do not have health insurance. And so they will use Crozer ER as their primary care. And then although we do have an urgent care facility, but people without health insurance can't pay $150 to see a provider because their leg hurt. They're going to go to Crozer where they can get the care that they need. And so I am extremely concerned about people who will not see a provider at all right now because there is no provider to see. There's nowhere that they could go. So I encourage people as much as they can to use Chest Penn because they are available. They are available during the week. I think they have limited hours on the weekends, and they do accept walk-ins, so that's probably going to be their next best bet. In terms of transportation, we've been working on transportation for months and trying to build a model that possibly involves volunteers to allow people to get rides to and from their medical appointments. And so we've been looking at a number of models around the country where organizations have been doing that. So we started working on that actually in February. It's just taken time to
Is it in operation now, or?
It is not.
Okay.
We're still doing research. It would have been if it just takes a lot of resources that I just don't have. And so we're plugging away. So eventually we'll get there. I'm hoping we can get there by the beginning of the fall so we can help get people to their doctor's appointments when they need them.
Are you familiar with the proposition for a pop-up clinic? I think it was by Christiana Care near Chester to kind of mediate, I guess, all the patients that have been sent to Riddle.
No, I haven't heard anything about that. And I really encourage any organizations that are offering or looking to offer healthcare services in Chester to please reach out to me in my office, because I want to make sure that that Chester is represented in these conversations. What I've seen over time, and not just in the healthcare space, but in different spaces in general, is that decisions are being made about people that live in Chester, and there's no one from Chester at the table. And so I'm just encouraging organizations to please make sure that there is at least 2 or 3 people from Chester at the table, because you cannot make the best decisions for Chester if you don't understand the landscape of Chester. It's a small town, but it requires, it's not a cookie cutter town. You can't just do you can't just plan to provide any type of programs or services without having a good understanding of the city, how it works, how we work together. And so we want to make sure that Chester voices are at the table as these decisions are being made. So if it's not me, put somebody at the table, please. Because I've been in meetings in this role particularly that I hear people talking and saying things, and if I'm not there to say, no, that's not going to work. No, people don't go there. No, that's a terrible location. It may make sense to you because you're looking at a map and and some data, but it's not going to work. And you don't know that if you don't have a person at the table that actually knows the city and knows the people in the city and knows how they operate. And so I've really been trying to push that.
Yeah, especially it sounds like through the work of Health Educated, you said inspiring younger people to get involved in healthcare. Do you work with a lot of Chester youth who are interested in pursuing a career in healthcare?
Yep. So every spring, for the last 2 springs, we've held what's called the Dream Expo. And the Dream Expo is an opportunity for middle school students to be exposed to advanced careers in medicine. And so they have opportunity for them and their parents to meet physicians, surgeons, and dentists and pharmacists, of course, and nurses, clinical psychologists, the veterinarians, is all the advanced healthcare providers. And so we do a full day event with workshops and panels. And so that's the main way that we work with youth to expose them. I ultimately want to start college tours with middle school students as well, to get them on a college campus so that they can aspire to pursue college once they get to, by the time they get to high school. Because we know that in high school, every single grade counts. And so everything you do in high school counts. And so we want to make sure that we set up young people for success as they get ready to pursue their high school careers, so that they can be quality applicants when it's time to apply for college. Well, so that's the main way. I mean, I would love to do more. I just can't. I just can't do more. But I would love to do more with young people on a consistent basis. Like I'll do career days and career fairs and things like that, but I want to do something more on a consistent basis. But it's just, I just can't right now.
Well, it sounds like you're tackling this problem from a lot of directions. I mean, systemically, inspiring leaders in the community to rise up and have a voice in healthcare, and environmentally, and also just at the level of, this is the resource you should go to get care. So yeah, there's it's multifaceted for sure. Going back to the insurance issue, I know Crozer served a high population of Medicaid patients. What's your opinion on its conversion to for-profit versus nonprofit, and just healthcare models in general in a community like Chester? What do you think works the best?
So a part of the challenge with Crozer, so Crozer had to be sold because it was in financial danger when it was acquired by Prospect Health. So it was already, having some challenges. One of the challenges financially that Crozer had, because it's in a community where so many people are uninsured or they are insured through the government, which historically has low reimbursement rates, it can't survive. It's very challenging to survive when a certain percentage of the patients you see don't have insurance, which means the hospital is not going to get paid, or they are receiving government insurance from Medicare or Medicaid, which is not going to pay enough to cover the cost of care a lot of times. And you don't have enough people with commercial insurance who are employed and have commercial insurance plans. The payer mix is just not going to be one that will allow you to thrive. You'll probably make ends meet. You'll probably come into black just barely, but you're not going to make a lot of profits. And so a place like Crozer really needs to be nonprofit so that it can, or, a hospital in this area should be a nonprofit entity, not because the nonprofits don't need to make money, because they need to make just as money as anyone else, but because you'll qualify for more support and more grants when you are a nonprofit entity. You can get more donations in a way that you can't when you are for profit. So we need a hospital that has a mechanism to be able to receive a diverse stream of revenue, because the insurance is not going to be enough, because we don't have enough people here that have commercial insurance plans, or people that can pay out of pocket for healthcare costs. Like if I wanted to get some cosmetic procedure done, I have $500,000 in the bank to drop because I can afford it.
Right.
So we don't have enough people that can do that.
Governor Shapiro recently proposed legislation to rein in private equity in healthcare, which would hopefully prevent something happening like the really abrupt closure of the hospital. What's your thoughts on something like that?
I think it's great. I think it's unfortunately it didn't help us, but it'll help other communities around the state and prevent them from the torture that we are currently going through here in Chester. And so it's a step in the right direction for sure. I'm not against for-profit altogether, but private equity, just in terms of them really needing to put money in the pockets of their shareholders in a very strategic way. And they have a playbook that they have used around the country. It's not, they use their playbook and they capitalized on all the assets that Crozer had to offer, and they did it in a beautiful way that did not break any laws. And so they just opened the book, hit play, and it just turned out like it has turned out in communities all over the country. And so it's so unfortunate that it has come at the sake of our lives, but they just pulled their playbook out and went to work.
I believe 2 other hospitals owned by Prospect in Delaware County are now declared bankrupt as well.
So when Prospect filed bankruptcy, that shuttered all the hospitals. So they had purchased, it was 4 hospitals altogether in Delaware County. When they purchased it, 2 they closed 2 years ago, and then in May, the last 2 closed. So all 4 are closed now.
Oh, what do you think it would take to restore healthcare in Chester? Obviously, you have a lot of efforts off the ground right now, but long term, what do you think it takes?
I think it is going to take people, number one, who care. I think that it's going to take some time. I personally don't see Chester existing without a hospital. We can't be the home of the state's environmental polluting industries, where the state approves these industries to be here and approves them to expand their operations. So that's putting more pollution in the air. And we can't be the home of that and be expected to exist without a health system. I don't see it. I don't know why anybody would expect that to happen. And so in my mind, we're just gonna have to build a hospital. We're gonna have to have a hospital here, because the people won't. We are going to perish. We are going to perish, and there's no other way to survive. I can't eat enough green, healthy vegetables and produce and do enough yoga to overcome the pollution that you're exposed to when you live and work here. And so we're going to need healthcare providers here. And so I know that there will be a hospital, and we will just have to build it ourselves. I reached out to the governor's office about this, had a meeting with his team, and I just laid it out. And they agreed to everything I requested. I requested that they make sure that we have a seat at the table when decisions are being made at their level in terms of what healthcare providers will be coming back into this to this area, or healthcare systems. We also talked about them helping us to rebuild the healthcare infrastructure.
Right.
And then I also asked for a feasibility study so that we can learn what healthcare infrastructure we need to have here in order to take care of the specific needs of this community. And so
Right, the unique needs of Chester, with the pollution and the lead. And,
considering all of that. And so they were open to all of those requests. And so I'm just in the process of getting proposals for the feasibility study. I have one already, I have one coming, and so I wanted to send them 3. So if anyone out there knows anyone that can do a healthcare feasibility studies, send them my way. It's been really hard to find an organization that can do this. I'm surprised, but that's what I need, so I can send over the proposals and see how the
Yeah.
governor's office can help to support that.
Oh, well, it sounds like a plan is in action, which is hopeful.
Mm-hmm.
Well, my last question was, I mean, you're working in a dire landscape right now in healthcare. What gives you hope on a day-to-day basis for the future of Chester Health?
That's a good question. I'm just a hopeful, positive person anyway, and so I know as long as I'm working and I have the support of people around me to work on things, I feel like we can get something done together. The mayor has been very supportive, and I feel I don't know if he knew what he was really getting when he wanted me to come on board, but every idea I take to him and everything that I want to do, it is always yes. How can we do it? What do you need me to do? He's never said anything. Well, I don't know if we can. He's like always for me. Now he doesn't have the last say,
Right.
but he's never like I don't think that's a good idea. I was like, can we approach the governor about this healthcare system, because this is crazy? And I was like, I don't know what he's gonna say, and he was like, absolutely, let's do it. And so that's what we
great.
did. That's what we did. So I know I take him. I don't know. I just when he calls me, I'm like, I hope he's not about to fire me, because I know I could be a bit much.
Never.
But I'm just trying
like
to.
you're providing a lot for the community. I don't think you'd want to do
I don't
that.
know. I'm just just try to do the best that I can to serve the people and to honor God, and to just do my best. So that gives me hope that I know I have support at work. I have a new supervisor now, and she's mega supportive. She is the bomb. So I'm really I'm really fortunate to just have a great team behind my back at work, and then to have the support of the community has been wonderful as well. And then all the partners that sit in our meetings, and we meet every week sometimes, or every month, or however often I need people to show up, they're showing up. And so that gives me hope, that keeps me going, because I know I'm not alone, although I feel really overwhelmed a lot. I know that if I needed something, there are people that would support me.
And how do you spread that hope to the community or members of the community who might feel despondent in the face of this?
I know. I feel bad because I don't have time to post on social media. I'm not about getting attention about stuff. So people may think I'm not doing anything, but y'all, I'm out here working. I am working every single day. I am working as hard as I can. And so although you don't hear from me, I'm not posting, I don't have time. That would take time, and I don't have it. So I use my time working on things. And so I would say just know that as long as I'm around, I am advocating for Chester. I am fighting for Chester. I'm asking for resources. I'm doing everything that I can in my power to do something. So I'll give you an example of how I got derailed again.
Seems like a theme.
I just be minding my business, and they just always keep coming after me. So I got an email that people that were trying to get their medical records were now being charged a fee for their medical records.
Right.
So it had been free, and then now there's a charge in place. And so I am like, why are they haunting us? Why don't they leave us alone? Like, y'all close the hospital, just go. Just leave us alone. Why are you still getting on us? And so then I had to prepare a letter for the receiver of the hospital at the time, for the judge. I sent one to the governor's office and to the attorney general. I'm like, nobody can afford to pay this fee. We didn't ask for this hospital to close. People need new providers because the hospital closed. They don't need new providers just because they want to go see somebody else. Their providers are gone, and they need to get their medical records so that they can establish care with new providers. In fact, there are some offices that won't even schedule an appointment with you without your medical records. And people can't afford to pay these medical records. So we had to do this whole send out letters and get support. So
is this common to access your medical
it
records?
It is legal for companies to charge a fee to access your medical records, because there's a cost associated with it. The staff has to pull the file and send the record and blah blah blah. So it is legal to charge a fee, But in this unique case where the hospital was closed,
Right.
and people need new providers because their hospital closed, it's not like they're choosing, like, oh, well, I don't like going to Crozer, I'm going to go somewhere. Crozer does not exist. And so in this case, they have to find new providers because the providers won't schedule appointments unless they have their medical records. But they have 3 or 4 people that live in the house. They can't afford $100, $200,
Right.
$300 to get access to their medical records. And so, to my surprise, so I sent a letter to the receiver of the hospital, to the AG's office, to the judge, and then I also reached out to the governor's office. And everybody got back to me. I thought I was going to have to follow up. And the judge, her team responded 1st and said that they would add it to the court hearing that was coming up the following week. And I was like, oh, we done did something. So
Wow.
that was discussed in the hearing last week. So I listened in on that hearing, and the judge is not really sure what is going to happen because you have to follow the law. And so she's just trying to figure out, what does the law say about this? What have other courts decided about this? But it is legal to charge people, but in this case, it is the hospital closed. They don't have a choice but to find other providers. They cannot afford to pay this fee.
Yes.
What can the court do? So that's what we're still trying to figure that out. What the court is trying to figure that out. So it'll be discussed, I guess, at the next
Okay. So you're still waiting
hearing
on a
date.
response.
Yep.
About that.
But the attorneys from Delaware County and the Attorney General office in Pennsylvania, they represented us very well, because I was pleasantly surprised, especially the attorney that represented Delaware County. I rarely hear people advocate for Chester that's not from Chester. And she was on it, and she knew her facts, and I was like, "This girl is good." And so I appreciate what she shared with the judge about how egregious this fee is, and it's not going to work. So that was one other thing. So I'm trying to work on all these other things, and then this new thing comes up, and now I have to put time and energy into that, and it's just always something, and it's not.
Sounds like a whirlwind.
Oh my gosh.
But it's hopeful to hear that these efforts are in motion.
They are. So
and people are responding.
Yeah, they are. So I want the community to know, although you don't hear from me, I'm not posting about anything. I don't have time. It is just because I'm just trying to get the work done. That's where I have to focus.
Oh, it looks like we have a question about, could you name any primary care physicians that are accepting patients?
Yep. So the closest one here would be Chest Pen. If you go to Chest Pen, which is right on 9th Street, I forget 9th and Crosby, I think. And there's also a physician, Dr. Stankiewicz, Edward Stankiewicz. He's in Marcus Hook. He's not far from Chester. And then anyone else, to my knowledge, there's also a primary care clinic for people that don't have insurance at Widener. They have a community clinic as well at St. Paul's Church on 9th and Melrose, 9th and Madison. So those are the 3 places that you can go to for now. And then there's also, if you want to go outside of Chester, you can connect with us through Together for Chester, and let me pull up the phone number for you to call. Anybody find it yesterday? Give me a second. I'll pull up the phone number. But you also had a question, Ella, about legislators. I thought you wanted to ask me, and I wanted to talk about that, but I forgot the question. What was the question?
Let me see.
What am I looking for? All right. So the phone number to get connected to us through Together for Chester, so that you can get connected to healthcare providers, is 610-479-0463. Again, 610-479-0463. So you can call that number, or you can stop by City Hall anytime between 9 and 4:30 to get connected to healthcare providers. You can also go to Keystone Wellness. They have someone there all day. That's at 9th and Yarnell. Keystone Wellness Center also has a person there that can get you connected. There's also someone at the Access Center on 7th and Booth. Sister Maggie can get you connected to healthcare providers. So we've trained almost 30 people around the community on helping people get connected to healthcare service. So a number are in churches. They're also you can also go to Chester Education Foundation, which is on 4th and Avenue at the States in the Crozer building, to get connected. And so we've done a lot of trainings so that community members can get people connected to healthcare services
themselves.
Mm-hmm.
The other legislation question, it might have been a message that you'd like to share with Chester residents and to policymakers.
Oh,
Is
yeah.
that
So
what you're thinking of?
Yep. Yeah. So in terms of policymakers and, what I would say Chester residents, you determine the policymakers. The policymakers are up to you. So I really don't have a message for policymakers because as I have learned in going to different meetings on the local, the state, the national level, just hearing, observing, watching, policymakers are not experts in topics. And I'm not saying this to slight policymakers, but I just want the community to understand policymakers won an election. Mm-hmm. So they got enough votes to win an election. That does not make them an expert in fields. They rely on their team and other people to help educate them on topics. And so it's up to us as voters to vote. We have to vote for people that we know have our best interests in mind. Mm-hmm. Because when we don't do that, we lose every time. We lose every time. And no politician is perfect. You're not going to find a perfect politician, but you want to find someone who aligns with what you believe, with what would help you. You don't want to vote for someone that is against your own interests. And you don't want to not vote because then we end up with where we are today. And so I don't even have a message for policymakers because they're going to do what their constituents require them to do. That's right. They are going to move according to their constituents. So it's not really on. I don't have a message for them. I have a message for the people, and it is you have to vote. That is where you make a difference. That is how you change things in your life. Because what I've seen is that there are people that may be assigned to a district or be an elected official to a district. And if their constituents aren't engaged with them, they don't know what their issues are, and they're not going to advocate for them, and they're not going to make laws for them because they don't know. And so the power is in the people's hand. The people have the power. They have to activate. They have to use it, and that is voting. And then we have to do better at getting people to run for positions that have our best interests in mind so that we can have quality candidates who will listen to our issues and who will act on them on our behalf. Because one thing that I've also seen and learned, and it's just so much more clear to me now than ever, is that nothing happens if there's not a law in place. Everything goes back to what does the law say? What does the law say? So if there's not a law in place, there's no protections. And so...
And that speaks to the troubles you're facing now with accessing medical records.
Yeah.
Like the judge is reviewing laws that are in place for, can we provide these to people for free?
Mm-hmm.
So, yeah, an unexpected solution to the healthcare issue is starting with voting.
It is. It is. You have to. You cannot leave your vote on the table. You cannot. And I know that during the election, I don't know how much time we have. I don't want to get no bill from CMP Radio.
This is for my intern.
I don't know. I don't know the business operations in this studio. What was I saying? What'd you say?
You were talking about a bill.
A bill?
About
I'm sorry. I threw myself off. What was I saying, y'all? Anything? Y'all don't know. Are y'all listening? They not listening.
With access
I got my interns in here.
records.
Accessing medical records. All right, I don't know. We can close.
It's
I'm
okay.
sorry. I forgot where I was going.
Oh, well, thank you so much. I'm so happy you came to speak with me today.
Thanks for
And
having
I
me.
feel this interview is really helpful to people who want to learn more about what you're doing and the work that's being done after the closure of Crozer and moving forward with that. So thank you very much.
Thank you.